Can I do a little video of using the mask technique for resuscitation when we are doing it with a baby? So yes, I can. The one thing that I will say though is with this technique, it is now recommended where possible you do a 2-person airway technique with babies. And the reason for that is so that actually we get a much better seal from the mask to the baby. But there are sometimes situations where you may be on your own, especially if you are the initial person performing that resuscitation whilst you're waiting for the team to come along, for example. And so it's always really important to practice your mask technique as a student midwife, as a midwife, as a doctor, whoever it is that may be seeing newborn babies be born in reality. Now this next video that I'm going to show you, I did when I initially returned from maternity leave. It's a great way of being able to check your mask technique is actually to record yourself doing these things, and especially if you're doing NLS for the first time, recording the algorithm, recording your flow through things, going back through it a bit like a simulation and critiquing that in the background. So as we place this on, we do a C and E grip with our mask, and like a posh wine glass is how we hold the stem. What we do is align the mask in the cleft of the chin, making sure it fits the mouth and the nose adequately. And then the 3 P's: position, apply pressure to the mask onto the face, and pull up like a jaw thrust into the mask. And by doing that position, pressure and pull, it will help that air entry much better, a much better seal. It will prevent air leakage. So it will mean that you're doing more effective inflation and ventilation breaths. With all of these techniques as a student midwife, get as much practice as you possibly can. In university, in your units, ask your practice assessors or supervisors to come and do a skill station with you. If you can get onto a multidisciplinary training day within your trust, please do, because you'll get your hands on, you'll get that practice as much as you can. When you qualify as a preceptor midwife, ask to get your hands on again, and when you get the chance, go on the neonatal life support course, because it's a fantastic way to be able to learn and practice and simulate being able to do that effective resuscitation when it's required. Your university lecturers should be able to help guide you and record yourself and watch it back and see what your technique is like as well. It's a great way of being able to do that. Get your student midwife colleagues involved as well. The more practice you've got, the more confident and comfortable you will feel, the better your technique will be, which is when you need it the most in those emergency scenarios and you've got parents watching you, you will be able to do this far more effectively and efficiently.